Hi everyone, welcome back to this channel. Now we are going to talk about the tobacco industry contribution to the national economy. Did you know that tobacco's contribution to the Indonesian economy is very large and growing significantly? And that the cigarette industry in Indonesia is labeled as a double-edged sword for the government. We will learn more in this video, so stay tuned! Tobacco is one of the important plantation and trade commodities in Indonesia. The main tobacco products traded are tobacco leaves and cigarettes. The tobacco industry in Indonesia is growing rapidly in line with the increase in the number of smokers. This is related to the smoking habit of the Indonesian people. The tobacco products industry, or IHT, is one of the domestic strategic sector that has high competitiveness and continues to make a significant contribution to the national economy. The main contribution of the tobacco industry in the national economy includes employment, state income through excise taxes, and becomes an important commodity for farmers from plantation products in the form of tobacco and cloves. These are the three determining factors behind the increase in cigarette excise. The first one is controlling consumption, because it is considered to have an effect on health and the number of children who smoke is increasing. Next is big industry. Cigarette production chain involves many parties, including farmers, laborers, traders, and others. And the last one is its contribution to state revenue, because in fact, cigarette excise is the main contributor to excise revenue in the state budget. The percentage of Indonesian children 10 to 18 years old who smoke continues to decline in the 2018 to 2020. Based on the data from the Central Statistic Agency, or BPS, the percentage of children 10 to 18 years old who smoke reached 9.65% in 2018. The figure then decreased to 3.87% in the following year. In 2020, the percentage of children 10 to 18 years old who smoke again fell to 3.81%. In detail, children 10 to 12 years old who smoke by 0.13%. At the age of 13 to 15 years old, there are 1.64% of children who smoke. Meanwhile, children 16 to 18 years old who smoke reached 10.07%. Based on gender, 7.68% of children 10 to 18 years old who smoke are male. That percentage is more than girls aged 10 to 18 years who smoke. According to the Ministry of Health, or Kemenkes, there are a number of factors that encourage children to smoke, even though the habit is dangerous. One of them is because of a large enough curiosity about cigarettes. In 2021, the source of increasing cigarette excise rates for 2022 is again rising to the surface. The government will convey its certainty after the House of Representatives, or DPR, agrees on the draft law, or RUU, on the 2022 State Revenue and Expenditure Budget, or APBN. This is data on the average increase in excise tariffs on tobacco products. Starting in 2015, which was 8.72%. In 2016, it increased by 11.19%. In 2017, it fell to 10.54%. Also in 2018, it fell to 10.4%. Arriving to 2019, the government did not increase the excise tariff on tobacco products. And in 2020, it soared to 23.05%. After that, in 2021, it fell to 12.05%. Means, almost every year, the government, through the Directorate General of Customs and Excise of the Ministry of Finance, raises excise rates on tobacco products. The exception occurred in 2019, which coincided with the year the general election was held. At that time, the government maintained the excise rate on the tobacco products from the previous year. Production of tobacco products according to available data. From 2016 to 2018, there was a decline in production, where in 2015, it produced around 342.06 billion sticks. And in 2016, it produced around 341.69 billion sticks. There was also a decline in 2017, which only produced about 336.29 sticks. And in 2018, it produced 332.35 billion sticks. Until 2019, there was an increase in production of 356.5 billion sticks. And in 2020, there was a decline in production of 321.9, which was the lowest production figure. In 2021, the production of tobacco products experienced a total annual production increase of 4.3%, or at 335.9 billion sticks. Tobacco excise revenue. According to the data, it can be seen that the total excise tax always exceeds the tobacco products excise target. In this data, 2020 is the year that has the largest revenue from the total excise on tobacco products, which is 176.31 trillion rupiah, and in 2016 is the lowest compared to the other years, which is 143.51 trillion rupiah. If you look at the average for the past 7 years, the cigarette excise rate or tobacco product excise tax or CHT has increased by 10.92%. The Ministry of Finance note that the increase in cigarette price through tobacco excise or CHT made state revenues in the sector grow significantly. Its contribution reached 97% of total excise revenue. During the first quarter of 2021, the realization of excise revenue was 49.56 trillion rupiah, or 27.54% of the target. Meanwhile, CHT was 48.22 trillion, or 27.75% of the target. CHT revenues grew significantly by 73.92%. The high growth was due to the overflow of payment for excise tape orders from 2020 to 2021 amounting to 27 trillion rupiah. The Indonesian tobacco industry is faced with a dilemma controversy regarding its role in the national economy and its negative impact on public health and the environment. The largest beneficiary of the tobacco industry is the large-scale cigarette industry and multinational cigarette companies, while the Indonesian people accept the negative impact of the cigarette. Tobacco and cigarette have their own place in Indonesia, not only from a culture point of view, but also from an economic point of view. Countless trillion of APBN sourced from cigarette excise. However, all of that is not without consequences, one of which is spike in health costs. Indonesia has been named the highest smoking country or number 1 in Asia. Male smoking rate in Indonesia reached 76%. Other countries with high male smoking rates but far below Indonesia are Laos 57%, South Korea 50%, China 48%, and Vietnam 47%. So looking at the indicators of men who smoke, as well as economic data on tobacco in Indonesia, this country is one of the countries with a very high dependence on tobacco and cigarettes. The risk of the situation will clearly be seen in health problems, various diseases that are widespread in society due to smoking, and high health costs. In 2017, Finance Minister Sri Mulyani Indrawati stated that the government would use the Tobacco Product Excise Revenue Sharing Fund or cigarette excise of around 5 trillion rupiah to overcome the funding deficit of the Health Social Security Administering Agency or BPJS, which could potentially reach 9 trillion rupiah. The World Health Organization reports that smoking is the #1 killer in the world. In its annual report, WHO states that in 20th century, around 100 million people died from smoking. If there are no efforts to control tobacco or cigarettes, during the 21st century, at least 1 billion people in the world will die in vain, an increase of 10 times compared to deaths from cigarettes in 20th century. Currently, every year, around 5.4 million people die from smoking, and by 2030, the population who die from tobacco will increase to 80 million people every year. Of the population, 18% of death will occur in developing countries. Death rates from tobacco are much higher than deaths from tuberculosis, HIV or AIDS, and malaria. Various diseases can be caused by smoking and attack almost all parts of the human body. The negative effect of smoking is felt directly for smokers, active smokers, and for non-smokers or passive smokers. Ways to overcome smoking habits. Quitting smoking means you are giving your life the opportunity to live a healthier and longer life. Quitting smoking is the best way to prolong life and improve the quality of life, both for the smokers and those around him. There are the ways to overcome smoking habits: managing stress, avoiding smoking triggers, eating healthy foods, exercising regularly, involving family and closest friends, trying nicotine replacement therapy, and undergoing behavioral therapy. Quitting smoking is not an easy thing to do. When you find it difficult to stop smoking, try to remember the reason why you want to stop smoking. Quit smoking before smoking stops your life. Protect and love yourself and those around you by quitting smoking. That's all. Thank you for watching. Don't forget to like, subscribe, and comment down below. Bye!